A&P, so I'm kind of glad to get out of like the baseline things. But this officially starts the body systems. So we will be covering the rest of the year, like going through each body system. The first one is always the skin or the integumentary system, and then like by the end of October, middle of November there, I know we're like to cardiac and so forth. So I think we have skeletal system coming up in a few weeks and so forth. So get ready for all the different systems to come along. There will be a few weeks there, like Thanksgiving week, we won't do a system. Maybe another week there that I will take away the A&P for the week and so forth, okay? So this is integumentary system. I think that you could tell me the functions of the integumentary system without me even really talking about it. But go ahead and tell me what are some of the functions of the integumentary system and what is it? It's your skin. Good. So what do you think are some of the functions of it? What do you think it's there for?
Regulates temperature.
Regulates temperature. Is that the same thing you said?
No, I said protection.
Protection. All right. Protection regulates temperature. Two of the greatest things for sure. All right. Of what it does for us. Other things. So with regards to protection, is it keeps harmful substances out. It even keeps like too much water out, or any chemicals and so forth. Our skin takes the brunt of all of that, right? But it I don't want to say it flakes off, but it falls off even into plain sight and so forth with everything. So it keeps harmful substances out, but it also keeps water and electrolytes that are important to our body function in. It protects our internal structures as well, so our organs. Think about any cuts or blows or chemicals. It's going to protect us from that. It also acts as a gland, so when some people are like, oh, I need sun, even though I don't want any. When you know you need sun, you need to feel better mentally, sometimes physically as well. You need sun, and what you're needing there is vitamin D. Okay, so your skin acts as a gland. It takes that in and synthesizes vitamin D for you. Okay, so that's why it's so important to have that exposure to sunlight. The skin also performs an excretory function, so it does excrete H2O like sweat and other areas as well, or also salt, and then small amounts of urea, which is important too because we don't want too much urea. It also performs a sensory role in touch, so think about pressure, pain, and then temperature, which detects the outside environment of your body. And then lastly, helps regulate body temperature. The structure of the skin, you do need to think about the skin itself being an organ, okay? It's also called two other terms, called the integument or the cutaneous membrane. Those three words, skin, integument, and cutaneous membrane, all mean the same thing. There are two distinct layers in the skin, okay? Two distinct layers. And then there's a cushion underneath that, but there's two distinct layers. Those layers are very important to you to know. The epidermis and the dermis, okay? The study of skin and skin disorders is going to be considered dermatology. Derm meaning skin, and ology meaning study of. So this is something that you might have to label some things in, potentially. And this is maybe something that you have to label in your workbook as well. So this is a picture of the structure of the skin. You're going to see up there in that epidermis, you're going to see that stratum corneum up there at the very top that you think your skin is. Then the stratum germinative, I'm not saying that correct. And then you move on down to the dermis. And that dermis is really what feeds your skin. It has the blood vessels. It has the hair root. It has all of the living things within it, okay? There is not like a true layer, a third layer of the skin, but it is that subcutaneous or that adipose tissue underneath. So that's going to kind of keep everything in place. That yellowish stuff at the bottom, that's also called the subcutaneous layer. If you think about it, sub means what? Sub, not to eat, but what is the sub on a medical term? Submarine, so it's under. Okay, so sub means under. So if you think about the word subcutaneous, cutaneous is the skin. This is the layer underneath the skin. So talking a little bit more about each layer of the skin, starting at the very tip top, the epidermis there. It is a very thin outer layer of the skin. It is formed of stratified squamous epithelium. So stratified meant layered, okay? More than a single layer. Simple was single. Stratified squamous, which were the fish scale looking cells, epithelium, okay? The epidermis is avascular, and so that means that there's no vascularity to it, there's no blood vessels feeding it, and so forth. It is also the site of insensible perspiration, which is sweating or water loss through the skin, and there are 5 different epidermal layers. These are the layers that are shutting off all the time. The deepest layer here, that's right on top of the dermis, is going to be the stratum germinatum, okay? Its cells are continuously dividing, creating more and more layers and so forth. It receives oxygen from the underlying dermal blood vessels. This one has your keratinized and your flattened cells, and they continue to go up and are pushed towards the surface. The stratum corneum, this is going to be superficial. So when something's superficial, it's on the surface of the skin, okay, or the surface of anything if it's superficial. This is going to be the surface layer of the skin right on top. It is composed of dead, flattened cells, and there are about 30 different layers of this. I just told you that this was stratified squamous, so this one has about 30 different layers of dead cells. Another thing, a layer of the epidermis might be also considered as dandruff. Again, those are going to be those dead cells that are clumped all together by oil. The term keratinization, this is the process by which the skin cells are hardened and flattened with the protein keratin, and so that they can move towards the surface, and this is what makes our skin water resistant, okay? So we perspire through our skin, but it also makes it where when we take a shower or bath or whatever, that you are not just soaking in all that water within your body. It makes our skin water resistant. Alright, so we talked about the epidermis, the most upper layer of the skin. Next up is the dermis, and there's a lot more to this layer than the epidermis, okay? It is located under the epidermis and is the largest portion of the skin. The inner layer of the skin, it is anchored to that subcutaneous layer. It is formed of dense, fibrous connective tissue. It is strong and elastic. It has those accessory structures, so like the hair root, the nerves, the glands in it as well. So those are going to be the accessory structures. It contains blood vessels, nervous tissue, and some muscle tissue as well. It can have excessive stretching in the skin that can cause small tears in the skin, producing white lines or striae. Anybody ever have or seen stretch marks? That's what I'm talking about right now. Okay. It's affected in the dermal layer of your skin. If it was just that epidermis, then it would go away. Does that make sense? It would regenerate. But if it's the epidermis, then it's causing those stretch marks as well. The thickness of the epidermis and dermis vary according to location on the body. So you need to think about the palms of our hands and feet are very thick skin, while our eyelids and our inner arm are going to be very, very thin skin. Okay, the thinnest skin on our body. Next up is going to be the subcutaneous layer. I don't know why, but we also have to have another term for that. It's also called the hypodermis. Hypo means under, the same as sub. Okay? And so, it's also called the hypodermis. This is the tissue that lies beneath the skin. So it's not a true layer of the skin. It's just the epidermis and dermis, and then underneath the skin is the subcutaneous layer. It is formed of loose connective tissue and adipose tissue, which is fat. It is highly vascularized, and it really has 2 roles. Mainly to insulate the body from extreme temperatures and changes in the external environment, and then next is to anchor the skin to those underlying structures. We had a test question that the adipose tissue is there to kind of keep things in place, right? Organs and so forth, including the skin as well. Some areas of the subcutaneous layer, we don't have as much, like over our knuckles, we really don't have that subcutaneous layer there. But also subcutaneous injections are given due to the rich supply of blood vessels, and drugs can be absorbed in this layer very well. So when it's a sub-Q injection, that's typically a very, very small needle, okay? Even though we're going down through those 2 layers of the skin and going into the sub-Q, we don't need a very big angle. We don't need to go in that deep, honestly, because we're just going into the subcutaneous layer. So an insulin shot is subcutaneous. We're going into the adipose tissue. But the big injections with the antibiotics and stuff that you get are intramuscular. So we wanting to go into the muscular tissue through the epidermis, through the dermis, through the adipose, and then deep into and that's why they're a straight shot. Okay, when we do those, give those as providers, they're basically like a 90-degree angle. Where these subcutaneous, we do like a 15 to 45-degree angle to give these injections. Okay? So you'll watch these kind of go as well. Your TB, it's going to be intradermal. So where do you think that is? Into the what? Into the dermis. So it's even less of an angle than the sub-Q. Insulin and stuff like that is sub-Q, but TB tests, they are putting it right underneath into that second layer of the skin, the dermis. So that's why it is the smallest needle you can get, even smaller than insulin needles and so forth. The skin itself, can absorb many different chemicals as well. We mainly think about this in our different areas and fields, even with animals, because our skin can even absorb drugs or medications. So if any of you guys ever seen a patient or maybe a family member with a patch on that's for medication, they can be hormonal, they can be pain patches, there's patches for a lot of things. Those are the two most common, and they're called transdermal medication. And they're just put a patch on the skin. Their thought process there is that it can provide like pain relief, potentially hormones for like a week at a time, leave it on, take it, replace it. What's another transdermal option for smoking? What are those called? Nicotine patch. Okay, so those came out several years ago. That's the first thing we do. We have a patient that's going to be in the hospital for a little bit. We just go ahead and slap a nicotine patch on them to help with those withdrawal symptoms and so forth. If we know they're going to be in the hospital, we just go ahead and get them a nicotine patch and put it on them, okay, to help with those withdrawals. So with these transdermal patches and so forth, the medication is absorbed by the dermal blood vessels and transported by blood throughout the body. Also, you can have these intradermal allergy testing. Anybody in here ever had those allergy tested before? An allergy tested?
No, but my brother.
I do not wish it on anybody. They give you a shot and let you have had it done. Like, they might give you 20, okay, on your back in the dermal area. And they spread them out a little bit so that they can keep them. And then they keep track. Okay, we just injected you with cat. We just injected you with grass. We just injected you with tree here. And they have a labeling system. And a system that they do it. Inject, 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 inject. The back is a good spot. Inject, 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 inject. And then they watch for a reaction. Okay, and they have epi on hand to shut down a reaction, epinephrine. So these are another example of medications that we can put into that dermal space because there's vessels in it that's going to quickly go into the bloodstream. I will tell you, some of those pain patches though are becoming very dangerous. Surprise, surprise, because people are chewing them. Yeah. My husband has picked up one dead person from chewing them. Okay, fentanyl patches. And then the second one, they Narcaned, and they came back mad. So when you come back out of Narcan, you better be watching yourself. Or not the person doing it, but everybody else better be ready to put up some guns, like, and fight, is what I'm saying. Okay, so when they come back out of that Narcan reversal, especially fentanyl and fentanyl patches, if it works, it's great because we can save a life with it. But they're going to come up back fighting, is what I mean. They come out from it fighting typically. So these, and with the hormones too, they can be not used correctly, but they can also be used correctly in a lot of different ways. And before nicotine patches, it really didn't do anything for our smokers in the hospital, and it caused a lot of problems. So nicotine patches really in the hospital aspect have helped a lot. Some people use them to wean themselves off tobacco products as well. But they've really not decreased their whole desire for smoking while in the hospital, but they really lessen a desire for that. So there's some very helpful things. It's just a shame that fentanyl patches, what they were really put into place for is for cancer patients. So it's really sad that those are being sold on the street from cancer patients, basically, or being stolen out of pharmacies or whatever they are, because they're really there for cancer patients or hospice patients near the end of life, okay, that can't take oral medications. So pretty sad though. There's also a danger of drugs being taken in, so like pesticides, cleaning products in your skin, acetone nail polish remover, mercury. You guys probably really don't know much about mercury, but we used to have these thermometers. I can't even show you one because we don't have one anymore. Glass thermometers is what we used, like when I was a child, and they have mercury inside of them. And mercury is very, very poisonous if it gets onto your skin and to your mucous membranes or anything like that. So they took it away. But this is why you should wear gloves when cleaning. I'm kind of guilty at home, and I'm not a big glove wearer, but especially I told your CNA students yesterday about wearing gloves when dealing with those wipes at the hospital or medical locations as well. Skin color, okay? This is determined by your genetics or your genes, also your physiology, and sometimes your pathology, okay? What determines our skin color is not the number of melanocytes, okay, so melanin is, but more importantly is about the melanin that is secreted, okay, so it's not about the number, but about the amount of melanin that is secreted. If a patient has dark pigmented skin, then they have more melanin, okay? And melanin is secreted by the melanocytes in the epidermis, so that outer layer of the skin. So all of our dermis looks exactly the same. It is truly just that epidermal layer that is different. The more melanin secreted, the darker the skin. But there are also melanocyte malfunctions. So there's one called albinism, okay? And have you guys ever seen where they have a lack of melanin? Albinism is albino. This can be animals or even humans, either way. Vitiligo, which are white patches, and some people get that mixed up with albinism. Also, moles are concentrated in local areas, and then melanomas with skin cancer, which is, there's a lot of different melanoma skin cancer now. Some of it very easily treated, but some of it, depending on the type, is not either. If the patients have a yellow pigment, that means that their keratin is higher, there's presence of keratin. So in the Asian population, keratin is more prevalent. So this is where there's going to be a presence of melanin that overshadows the keratin tint in most of these people. Physiological changes in skin color, cyanosis. Cyan means blue. This mainly comes from poor oxygenation, and it causes a bluish tint. Blushing. Everybody can blush. This is when the blood vessels dilate and causes reddening of the skin. Also, if you're having some type of reaction, this is what caused that blushing on your skin or the redness to come out. Pallor, this is where the patient is very, very pale or white as a ghost, right? And this is because the blood vessels are constricting down and not good either, right? Pathological changes in color, those were physiological changes before. Pathological are one of the first ones and most common one in newborns is going to be jaundice. It can also happen in any other age group as well. If someone has a liver problem or their liver has been infected, then they could also be jaundice. So we see it in newborns, but we also see it in patients that are dying quite a bit. We see that their skin starts to yellow in color. This is because of something called bilirubin. It is a yellow pigment, and it is deposited in the skin, but and what's happened is the body is unable to get rid of it due to the damaged liver. This is one of the things that the liver does, is to get rid of it, and if the liver is not functioning well, whether it's alcoholism, whether it's end of life for cancer, or whether it's a newborn, then it could cause yellowing of the skin. Bronze skin. This is different to see. You think that they're like really, really tan, but it's even more than that. It almost has a shine to it as well. And this is where the melanin is overproduced. Ecchymosis. And so ecchymosis is going to be black and blue bruising, so blood escape. Really think of our elderly patients with ecchymosis. Oh, goodness. Oh, gosh.
You want to learn about the male pyramid? Especially when we come to ask you if you want me to show your entire class.
Yeah, let's stop real quick. She's got something to show us. I wouldn't normally have her stop, but, Here's the
Do you
deal,
go
why
to
I'm even
SSM?
laughing about this. When we went to clinical last year, I didn't know what this was because I had never seen it before. Hold on, what? This is really new because I haven't even seen this.
This
one.
came out in December at it's a male Purwick. So if you go to SSM, they have them.
Okay, we don't go to SSM. But I saw those banana things for the first time last year.
That is
What
for
are they called?
female.
Okay, all right. So we'll talk about that. Do we have any of those, or do you?
I can bring one. I work at SSM,
Okay.
so I can bring.
All right, let's look at the male
On
Purwick.
Monday.
This is new technology in healthcare that
I have my
blew my
notes.
mind last year at clinical.
So
Okay.
for the male Purwick, which is, it'll go in. There's a hole here. You'll put it in.
We will really have to do this at clinical.
You'll peel off the clear thing right here. Stick it here. And stick it there. And then they'll pee into this bag. This will hook up to a tube that will hook up to suction, and it will suck all their pee into a canister. I like these better than common catheters.
Oh my gosh, yes. This looks so much nicer than that banana thing.
Yeah,
Female.
they need a
That's
better.
a joke.
Yeah, I'll bring one
Okay.
of those too, and I'll bring one.
I think I might have grabbed one last year. I might have one yellow. But so this is a male Purwick is the
Yes.
name of it, and that's the only name that you're gonna hear for this, okay? And so there's some tape up top, some clear tape that you're gonna stop.
Yeah.
But does hair affect that at all?
Yes. If they have pubic hair, you have to shave them. Otherwise, it's not going to stick.
Okay.
But if they're jerks, whenever you go to take it off,
Okay.
perfect.
All right. All right. Mm-hmm.
Perfect.
Yeah.
But you have to change it every 12 hours. And then if it's soiled, you change it too.
Well, a male Purwick.
I love them. Love them.
So you're using them a lot.
Yes.
Okay. The female Purwick, I'll just tell you about it real quick. It looks about the shape of a banana. It's got some cotton in it, and this is what I saw for the first time last year. It just blew my mind at clinical. I'd never seen before. You just put it down in the woman's vaginal area. It's large, or you just set it there. It's also hooked up, same
Like an
concept
external
to,
tampon.
yeah, an external tampon is right, because you don't stuff it inside anywhere. Okay, it's just sitting down there. It's also hooked up to suction, and so you're seeing pee up on the wall. I'm like, man, I've never seen this. And at the time, I'm like, 16 years in nursing, 17 years. I've never seen pee being suctioned up to the wall section before, but whatever. So, okay. All right, cool. When we get there to,
When they graduate, they can apply to SSM.
oh, she wants you to work at SSM.
They will take you.
Oh, cool.
They will
Yes.
take you.
Cool, cool. Thank you.
Thank you.
You're welcome.
Interesting.
Thanks, Ms. Straube.
Yeah. Miss Belcher's getting ready to show you guys something with the uncircumcised man.
Yeah,
There you go.
a couple of our students don't know what it looks like. So.
Yeah, I know. Or most people. Yeah. Alright, so back to this ecchymosis. That is bruising. Black and blue underneath the skin with blood escape. It is very, very common in elderly patients. They just barely touch something and they have bruising happen sometimes. A lot of them are on blood thinners. They're not being abused, or they could be being abused. But the majority of them, I promise you, it's just more that they're on blood thinners, and they bleed very, very easy. This is what I was worried about. This is just going to show you some pictures that are not coming up of cyanosis, which is bluing. These were pictures from your textbook, so honestly, they're not like anything new I pulled off or anything like that. So cyanosis is blue, pallor is pale, jaundice is yellow, and then bronze tinting. Okay. Accessory structures of the skin, so hair. Hair's function is to detect insects, to protect the eyes, think about our eyelashes, okay? To keep dust out of the lungs, and to reduce heat loss as well. The term for loss of hair is alopecia. Alopecia, for baldness or loss of hair. So if Mr. Spencer comes in here, we can say, man, you have alopecia, right? And he can't get too mad at us, right? Alright, anyways. Growth of hair is affected by the sex hormones. So those are going to be estrogen and testosterone. Okay? The onset of those comes in puberty, and so then that's when it hits the axillary. Remember at the beginning, it's going to be your underarm area and pubic areas. The color of your hair is influenced by the type and amount of melanin. So dark hair has an abundance of melanin, where blonde hair has less melanin. White means there's absence of melanin, there's none at all. And gray is a mixture of melanin versus not. And then lastly, the red hair contains iron. Okay? The texture of your hair is determined by the shape of the shaft of the hair. And there is a diagnosis in several different things, especially endocrine disorders, other things, hormone disorders, but they cause this hirsutism that is shaggy or excessive hair. Nails. This is the function of your fingernail is to protect the tips of the fingers and toes from injury. Okay. There are conditions that are affected by oxygenation of the blood supply, trauma, and nutritional deficiencies. So we can sometimes look at your fingernails and tell nutritional deficiencies and so forth. Other thing is going to be is that we are looking at fingernails and we push down on them, okay, for capillary blood flow. And so if you real quickly push down with the top and the bottom finger on one of your nail beds and it goes pale and then comes back, then it should come back to pink within less than 3 seconds. Okay, so go ahead and do that. Push down and then release and count, and it's pretty quick. As long as it's less than 3, it's fine. There's a female I've never seen before walk around her belly. I got it. I'm not sure. She looks. Okay, well, the police academy is out there, so I think we're
It took
good.
my 11 seconds. It was like staying white.
Really? Let me see it. Your fingernail?
That one looks like white.
Right.
Yeah, so if it was that way before, so do this pink part down here, so you see that I just put my fingernail there.
She got
Yeah, it
plastic
puts it on
surgery.
the second. Yeah, but your white, that white on the end, that's, don't, she's going inside?
Yeah.
Okay, well, that's fine. It might be a guest speaker. I mean, when I say it's fine now is because I see that, this class is out here. It may be a sub. I think Mr. Sloy has a sub today. I know he didn't ride with me. So, clubbing of fingers is also from a chronic lung condition. Brittle fingernails could possibly mean poor nutrition. And then cyanosis, again, blue, the same thing as skin. With nails, it's going to be poor oxygenation. One of the first places you're going to see if the patient doesn't have good oxygen levels is underneath the fingernail beds. Okay. Other accessory structures of the skin. So these are mainly going to be this dermis layer. Yeah, there she is again. She's the sub. Gotta be. Are sebaceous glands. Sebaceous glands are oil glands. This is what is also responsible for pimples, for the most part. Okay. So they secrete sebum into the hair, which is oil, into the hair follicle. This helps lubricate and helps waterproof hair. But also within the sebaceous glands is the vernix cernosa, which is the newborn. This is where babies are born with all that white cheesy stuff, okay, and covering that looks like cream cheese, honestly. Also within the sebaceous glands are those blackheads and pimples, and when exposed to air and it dries. Okay. Seduferous glands, these are sweat glands. So you need to remember sebaceous oil glands, seduferous sweat. Okay. The sweat glands, they secrete sweat through different pores. There are 3 million sweat glands over your body, and there are 2 different kinds, the apocrine and eccrine. Okay. The apocrine are usually associated with the hair follicle, activated by emotional stress, so you don't even have to be doing any physical exercise for these to be working. Okay, and also affected by the sex hormone. So this could cause body odor when the bacteria enters the chemicals of sweat. Eccrine glands are not associated with the hair follicles, so they are involved in the temperature regulation. So these are going to be why we sweat with exercise. They're going to be responsible for sweating on the forehead, the neck, the upper lip, the palms, and the soles. Bless you, bless you. If you're too hot from exercise or heat, you could secrete up to 1 gallon of sweat per hour. Okay? And it's when you're not sweating, when it's extremely hot out, that it's a problem. Because when you're not able to sweat, you think, well, that's good because I'm keeping it in. But honestly, it's gone too far. Okay? It's gone too far at that point. There are also a couple other different types of modified sweat glands. And they include the mammary glands, which secrete milk, and the seromonous glands, which secrete earwax. Alright, we're going to be talking about body temperature or the 4 processes by which the body loses heat within here, the integumentary system, and then we will be done. So the natural body temperature is anywhere between 97 to 100 degrees. I need you to remember that it is really 98.6 is a normal body temperature. 98.6. But have you guys ever had a 98.6 every single time you've had your temperature taken? Hardly ever. Okay, we really do run in between 97 and 100. Emma Niemeyer probably runs at 99 point something. No, I'm just kidding with you. And I might run at like right at 98. Okay, but certain people, when you take their temperature at the care centers or whatever you're doing, they're gonna be like, oh, I ran in the 97s. Don't worry about it. Okay, that's true. And depending on where you're taking the temperature, even some of us that are hotter would still run lower on those devices, okay?
Yeah, like I usually run like a 97.
You do? Yeah. See, I'm just picking on you for being hot.
At what point? I know, I'm like actually like feeling I'm sweating right now.
Well, really, if you're sweating too, then it makes your outer temperature cooler. Does that make sense? Because your body's doing the right thing. It's cooling you down. Do you know what I'm saying? Yeah. What were you saying, Courtney? Or Bella?
At what point is it like if you were or your temperature too low? 95.
Yeah, so 95 is too low. Really, like hypothermia can start really. Honestly, you would never accept a temperature in the 96s. Like if you got it, you know what I'm saying? You should never accept that and try again somewhere else. But like hypothermia is more like 95 degrees. So too cold for sure is 95 degrees and below. Too hot, a fever is considered 100.4. That 0.4 has to be there. 100.4 or higher to be a fever. A low grade fever is anything like 99.9 to 100.4. But a fever is not clearly defined until 100.4. Okay? But it also depends on where you're getting the temperature at. Okay? So if you're getting a core temperature, then those things are going to be higher. So an example there would be a rectal temperature. That's going to be the most core temperature you could get. And so, like an internal temperature. Does that make sense?
Is it like how dogs?
It is how dogs get their temperature. And then in the ICUs, we actually use core temperature because we are getting things down to the smallest amount and the most accuracy we need. We need no other factors to throw us off in the ICUs. So the neonatal, the PICU, the adult ICUs, we put a continuous thermometer in the rectum. It stays in there. Most of them can't feel it, but yeah. I mean, you know what I'm saying? Because we have them put out with medications and stuff like that. So, but yes, if we need continuous monitoring for temperature regulation, then yeah, you checking rectal temps.
Isn't it true that one side of your body is hotter than the other? Because
I don't know.
I mean, you only take it on this side, but then it'll be warmer on this side.
Yeah, I don't know that that's really true. I don't know about that. But I can verify that that is completely true. I understand what you're saying.
You should do a temperature on this side.
Yeah, you
Like,
need to
it'll
do
be
it.
like 0.3 off.
Yeah, well, we're going to be doing vital signs with CNA and stuff, so you can try some things there as well. We are not taking rectal temperatures. That got changed just 2 years ago. Just 2 years ago. We had to teach them on mannequins. Not kidding you. Yeah.
I think that wasn't allowed.
Yeah. We had to teach it on mannequins, but just 2 years ago, CNA program, state of Missouri changed that we're no longer doing those. So anyways, your shell temperature. Your shell temperature is the temperature of the surface areas of your body. So your skin and your mouth. They're going to reflect a cooler thing. So it's very normal for people to run 97.7 a lot. Guess what that is? It's really 98.7. Okay? Because where we're most of the time taking our temperatures are on the shell. Does that make sense? Not internally. And so the skin and the mouth usually reflect cooler. And so they are 1 degree lower than, say, a rectal temperature of 98.6. Okay? The term thermoregulation itself is the mechanism by which the body balances heat production and heat loss. You're going to see that a lot of these body systems play a role in thermal regulation, not just the skin. Heat production, how heat is produced. There's a metabolic process that releases thermal energy. Most heat is produced by the muscles, the liver, and the endocrine glands. It is also affected by food consumption or hormone secretion. If it's hypo, so that means there's a decreased temperature, so hypothermia would be decreased or lower temperature. Hyper would be a high temperature, and then physical activity could control heat production as well. Heat produced by cells warms the blood, which then distributes throughout the body. When people or neonates are shivering, most of the time we do not see neonates in the first month of life shivering at all because they really don't shiver. Good. They're not doing the shivering thermogenesis. They don't quite have that yet, but it's because they are born with brown adipose tissue. When you're first born and your baby is born, and say you were 8 pounds 4 ounces, guess what? You didn't stay 8 pounds 4 ounces very long. As soon as you were born, your weight drops by up to 10% or more. Okay? For the first week or more of life, you are losing weight, but what you're losing is this brown adipose tissue. So we're born with this extra fatty tissue to keep us going, to keep our nutrients in our body alive until the mother's milk comes in, or until the baby starts to grow their stomach. A baby's stomach starts off at like a pea size, okay? And that stomach has to be grown. So they start out not eating very much at all, but eating very often because they can't eat very much. Does that make sense? And then as they get older, they lose their brown adipose tissue, and then they start to gain weight after that. Okay? Their body is using the calories in that fat, that brown adipose tissue that they're born with. The sites of heat loss, the skin is going to be the number one place for that. So 80% of heat loss comes in the skin. Also in the lungs and excretion, so urine and feces, heat loss is lost there too, about 20%. The different types of heat loss are radiation, conduction, convection, and evaporation. Evaporation is that, I think, more of like the sweating. Convection is by air currents moving over the skin surface, so think about hot temperatures, cold temperatures, changing the skin temperature. Conduction is going to be moving from the warm body to a cooler object in contact, so like a cooling blanket, thin ice pack, or something like that is going to be conduction. And then radiation, this is moving from the body to a cooler air surrounding it, so like an air-conditioned room versus not. Regulation of body temperature is controlled by a part in our brain, and the hypothalamus, okay? It senses and changes the body temperature and then sends the info to the skin. Also, when the blood vessels vasodilate or they get bigger, it causes that flushing. Vasoconstriction is when it brings blood to the core. This is going to be in shock situations, so meaning that it may decrease the temperature of your body because your blood is trying to take it to the core organs, in which your skin is not one of them. Also, it's regulated by sweat glands and the skeletal muscle groups with like goosebumps as well. Body temperature is affected in heat extremes. Overheating is going to be 104 or higher, not 100.4, but 104 or higher. Hypothermia is going to be considered anything 95 degrees and lower. What happens during this is your metabolism really slows down. In neonate heat regulation, they have a large skin surface area, so they lose heat very quickly. That's why you dress them and wrap them in blankets and swaddle them. They have less insulation. They have that brown fat, but they don't have anything more than that. And then they are unable to shiver, so that creates a problem as well. Talking about burns, this is where this model comes in and is very helpful. On one side of this model is a normal layer of skin, okay, normal 2 layers. So this is the epidermis, the dermis with all the good stuff, and then the subcutaneous is this yellow down here. But if you flip this model over here, this is going to show you the classification of burns. And we've already spoke about this a little bit, but this is really helpful. In the first degree burns, this is mainly going to be a sunburn. Okay, this is going to be, most of us have probably had a sunburn, skin burn, or something like that. Okay, it just affects that top, the epidermal layer, nothing like that. A second degree burn, this one includes this blister right here. Okay, what's happening here is it's went through the epidermis and then it started at the top of the dermal layer. Okay. So it's went through the dermis. It could be a lot more redness. It can start to affect your hydration and so forth. Well, this is a 3rd-degree burn, okay? It's went through tissue, through that subcutaneous layer, started to a little bit. So all through this epidermal layer, you can't even see those structures that well here. This is going to be the most serious burn. It's life-threatening as well. It could also go down as far as like bone structures, muscle, and so forth. Okay? So if you're curious about burns, there's also a paper that goes along with it. You can please look at this model as well. One side is burns and one side is just the normal skin layers. All right. Within burns, how we handle them, how they say you have a 20% burn, 18% burn, and so forth. They use something called the rule of 9s. This is how, in the initial assessment, so that us looking at the patient or whatever, is how much of the surface area is burned. Okay. eschar is going to be when the tissue is dead. Okay. It forms a scab-like layer over the burned surface. eschar acts as a tourniquet, so sometimes they have to get rid of it, okay, and take it off. It also becomes a breeding ground for bacteria, and it secretes toxins in the blood. So if eschar keeps on being recreated, okay, then sometimes this is why patients have to go to the hospital and stay on serious burns, because then they have to get something called debreeding done daily. Okay, they soak them in big tubs. There's this whole process, and in the pediatric hospitals and everywhere, there's distraction therapists, there's child life therapy, playing video games while they're getting this treatment, and they're still screaming at the top of their lungs. They are majorly treated with huge pain control before, and after, and during, because we do not want them to put up with or have to deal with the pain during this process. Skin care really needs to be covered in all different ages. Of course, we want you to reduce your exposure to UV radiation, but we want you to get the sun because you need synthesis of vitamin D, right? So it's a hard area to cut in the middle there, but it's important for you to get sun, but you also need to reduce your exposure to UV radiation. Especially among the elderly, their skin dries out more easily. It's hard for them to retain moisture. And they have thinner skin, which bruises more easily and does not insulate them well at all. Alright, so this lecture included an integumentary system. We looked at its function, we looked at the different layers, and then we talked about several disorders throughout it. What was albinism? What was really wrong there? What was it lacking? Melanin. Yep. Melanin or melatonin. Not melanin, not melatonin. I'm on a different path here.